Have you ever taken a common pill without realizing it could raise your risk of dementia? It's a harsh reality many seniors don't hear enough about, that some medications prescribed to older adults could increase the risk of dementia. These aren't rare or exotic drugs. They're commonly used pills that millions of people reach for daily, sometimes without realizing the hidden dangers. If you're over 60, this video is especially important for you because understanding which pills to watch out for could help protect your memory and your independence. In this video, we'll reveal 4 types of pills that neurologists warn may contribute to cognitive decline and dementia in seniors. We're not talking about fear-mongering. We're talking about facts backed by research and clinical experience. You'll learn how these medications affect the brain, why they're prescribed so often despite the risks, and what alternatives or conversations you can have with your healthcare provider to stay safe. Stay with me until the end, because not only will you learn about these pills, but you'll also discover practical steps to talk to your doctor and protect your brain for years to come. This is about empowerment, not panic, helping you live smarter, longer, and with more peace of mind. Let's get started. Number 1. Anticholinergic medications. Among the pills linked to dementia in older adults, anticholinergic medications stand out as one of the most common and concerning categories. These drugs are often prescribed for allergies, bladder problems, sleep disorders, and even some gastrointestinal issues. At first glance, they might seem harmless or even helpful. After all, they relieve symptoms like runny noses, overactive bladders, or insomnia. But the way they work involves blocking a vital brain chemical called acetylcholine, which plays a crucial role in memory, learning, and overall cognitive function. When acetylcholine is suppressed, even temporarily, it can cause confusion, forgetfulness, and difficulty concentrating. For younger people, this might be just a mild side effect. But for seniors, especially those already at risk, long-term use of anticholinergic drugs has been strongly linked to accelerated cognitive decline and increased dementia risk. What makes this particularly troubling is that many older adults take multiple medications containing anticholinergic properties without realizing it, stacking up the effects unknowingly. Take, for example, Eleanor, a 74-year-old woman from Ohio who had been struggling with chronic allergies and frequent nighttime bathroom trips. Her doctor prescribed an antihistamine and a bladder medication, both with anticholinergic effects. Over time, Eleanor noticed she was becoming forgetful and more easily confused. She thought it was just aging, but after reviewing her medications with a pharmacist, she learned these pills might be contributing to her symptoms. After making adjustments with her doctor's guidance, she felt clearer mentally and more alert throughout the day. The tricky part about anticholinergics is how commonly they're found, not only in prescription drugs, but also in some over-the-counter remedies for colds, allergies, and sleep. People often assume if it's sold without a prescription, it's safe, but that's not always true, especially for those of us who've crossed the 60 or 70-year-old threshold. The cumulative impact over weeks, months, or years can quietly chip away at brain health. This is why it's essential to regularly review all your medications with a healthcare professional who understands these risks. Ask questions like, does this pill affect my memory, or are there safer alternatives? The right conversation can help you find medications that work for you without compromising your mind. Remember, this isn't about stopping treatment you need. It's about making informed choices. Sometimes a different drug, a lower dose, or non-drug options can provide relief without the hidden cost to your cognitive health. Staying informed is your best defense. Understanding the role of anticholinergic medications is the first step to protecting your brain as you age. It's a common pitfall many seniors fall into, but with awareness and the right support, you can avoid it and keep your mind sharp for years to come. Number 2. Sleep aids and sedatives. Another category of pills that neurologists frequently warn about when it comes to dementia risk in seniors is sleep aids and sedatives, including benzodiazepines. These medications are often prescribed for insomnia, anxiety, or restlessness conditions that become more common as we age. While they can provide much-needed relief and help you get a few hours of shut-eye, their long-term use may come with serious trade-offs, particularly for your brain health. Sleep aids and sedatives work by depressing the central nervous system, which slows brain activity and induces relaxation or sleep. This effect can become problematic over time as the brain relies on natural cycles of activity and rest to maintain memory, cognition, and emotional regulation. Prolonged use of these medications has been linked to increased risks of confusion, memory loss, and even a significantly higher chance of developing dementia. Take Henry, for example, a 78-year-old retired accountant from New York. After years of struggling with sleep, his doctor prescribed a benzodiazepine to help him rest. At first it worked wonders, but over several months, Henry noticed he was becoming more forgetful, struggling to focus, and feeling increasingly disoriented at times. Concerned, his family urged him to discuss this with his doctor. Upon review, they agreed to gradually reduce his dosage while exploring non-medication approaches to sleep. Over time, Henry's mental clarity improved and he felt more alert during the day. What makes this issue more challenging is how common these drugs have become in senior care. Many doctors prescribe them because sleep problems can significantly affect quality of life, and these medications provide quick relief. Yet the long-term risks are often underestimated or overlooked, especially when alternatives such as cognitive behavioral therapy for insomnia or natural sleep hygiene practices are available. Older adults also tend to metabolize these drugs more slowly, causing them to stay in the system longer and increase the chance of side effects like dizziness and falls, which further jeopardize health and independence. The combination of physical risk and cognitive decline can create a dangerous cycle. If you or a loved one is using sleep aids regularly, it's crucial to have an open conversation with your healthcare provider. Ask about the risks, discuss alternative methods, and develop a plan to minimize medication exposure while still getting restful sleep. Sometimes small changes in routine like reducing screen time before bed, adjusting meal schedules, or practicing relaxation techniques can make a big difference. The key takeaway here is that while sleep aids and sedatives can offer short-term comfort, their prolonged use in seniors might carry hidden dangers. Protecting your brain means balancing immediate needs with long-term wellness, and that means exploring safer paths to rest whenever possible. Understanding this risk empowers you to make smarter choices about sleep and medications. It's a vital step in preserving not only your nights but also your days filled with clear memories, sharp thinking, and joyful moments. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 3. Certain antidepressants. When we think about medications that affect the brain, antidepressants often come to mind, and for good reason. They play a vital role in helping many people manage depression, anxiety, and other mental health conditions. However, not all antidepressants are created equal. When it comes to their impact on seniors' cognitive health in particular, some older generation antidepressants, especially the tricyclic antidepressants, have been linked to an increased risk of dementia when used long-term. These medications affect neurotransmitters in the brain, altering the balance of chemicals like serotonin and norepinephrine, which influence mood and cognition. While these effects can improve emotional health, they can also come with side effects such as memory problems, confusion, and slower thinking, symptoms that can be mistaken for natural aging or the early signs of dementia but might actually be worsened by the medication itself. Take Linda, a 69-year-old retired nurse from Colorado, as an example. She was prescribed a tricyclic antidepressant after struggling with depression following her husband's passing. Over the next few years, Linda noticed increasing forgetfulness and difficulty concentrating. After consulting her new doctor and reviewing her medications, she learned that her antidepressant might be contributing to her cognitive decline. With her doctor's guidance, she switched to a newer class of antidepressants with fewer cognitive side effects, and over time her clarity improved. What makes this especially concerning is that many seniors are prescribed these older antidepressants because they are effective and sometimes less expensive than newer options. However, the risk to brain health must be carefully weighed, especially for those with other risk factors for dementia. The balance between mental health and cognitive function can be delicate, and open conversations with healthcare providers are essential. It's also important to recognize that stopping or switching antidepressants should never be done abruptly or without professional supervision. Each individual's mental health journey is unique, and the goal is always to find treatments that support both emotional and cognitive well-being. If you or someone you love is taking antidepressants, especially older types like tricyclic, ask your doctor about the potential cognitive side effects. Discuss whether alternative medications or therapies could offer relief without compromising your brain health. Staying informed helps you advocate for the best care possible. The relationship between antidepressants and dementia risk is complex, but understanding it empowers you to make choices that protect your mind without sacrificing your mental health. It's about finding harmony between feeling good emotionally and staying sharp mentally, both of which are vital to living a full, rich life. Navigating medication options with knowledge and care can make a profound difference in how you age, and it starts with awareness. Number 4. Over-the-counter PM pain relievers. Many seniors reach for over-the-counter pain relievers with nighttime or PM formulas to ease aches and help them sleep. These combination medications often include ingredients like dihydramine or other sedating antihistamines, which can have a significant impact on brain function, especially when used regularly. While they might seem harmless because you don't need a prescription, these pills can quietly contribute to memory problems, confusion, and an increased risk of dementia in older adults. The sedating ingredients in these PM pain relievers work by depressing the central nervous system, much like prescription sleep aids and sedatives. This leads to drowsiness, which can help you fall asleep, but long-term use can dull brain function and reduce mental sharpness. The trouble is, many seniors use these medications frequently because they're accessible and effective for short-term relief, often unaware of the hidden risks lurking in these common drugs. Consider Joe, a 75-year-old retired mechanic from Indiana who used PM pain relievers to help with arthritis pain and occasional insomnia. Over time, his family noticed he was becoming forgetful and disoriented, struggling to remember appointments, and sometimes getting lost in familiar places. After a careful review of his medications, his doctor connected the dots between the regular use of dihydramine-containing pain relievers and Joe's cognitive issues. With guidance, Joe was able to taper off those medications and explore safer alternatives, regaining some mental clarity. One of the challenges with these over-the-counter PM pain relievers is that they're often taken without medical supervision, especially because they are easily purchased at drugstores. People assume that if something is sold without a prescription, it must be safe for daily or long-term use. Unfortunately, that's not always the case for seniors. The aging brain is more vulnerable, and these sedating compounds can build up and cause lasting effects that seem like natural aging, but are actually medication side effects. It's crucial for seniors and caregivers to read labels carefully and ask pharmacists or doctors about the contents of these nighttime pain relievers. If you're relying on these medications regularly, discuss safer pain management strategies or non-pharmaceutical options like physical therapy, gentle exercise, or heat therapy. Remember, protecting your brain is not just about prescription drugs. Over-the-counter medications can be just as impactful. Awareness and cautious use can make a difference in maintaining mental sharpness and quality of life. Taking control over what you put into your body, especially medications, is one of the most effective ways to safeguard your cognitive health as you age. By staying informed and proactive, you empower yourself to make choices that support both your body and mind for years to come. If you enjoyed learning about these important medications today, please make sure to like, share, and subscribe to our YouTube channel for more valuable insights. Your support helps us continue creating content that informs and inspires. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Final thoughts. As we wrap up this video, take a moment to reflect on the 4 types of pills we've discussed: anticholinergic medications, sleep aids and sedatives, certain antidepressants, and over-the-counter PM pain relievers. Each of these categories carries hidden risks that many seniors might not be aware of, especially when it comes to memory, thinking, and overall brain health. Recognizing these risks is not about creating fear, but about empowering you to make informed choices and protect your mind. If you take any of these medications or know someone who does, the best step you can take is to have a candid conversation with your healthcare provider. Ask questions about the potential cognitive side effects and discuss alternatives that might be safer for your brain. Medication management is a team effort, and your voice matters. It's your health, your memory, and your quality of life we're talking about. It's also important to remember that none of this means stopping essential treatment without professional guidance. Many times, doctors can help find a balance between managing symptoms and preserving cognitive function. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.